And so if we can use technology to continue to keep that relationship open, it actually does build loyalty rather than degrade it. So I think it's something that we've had to kind of have a philosophical shift, a mental shift in our industry to really understand that tech touch is not a bad thing. It is something actually that puts us in our customers' inbox, in their phone, in their text messages, and does actually build relationship rather than break it down.
Welcome to a new episode of Covetrus Connected Care. I'm your host, Nicole Knight, and I'm Content Marketing Manager at Covetrus. Thank you for joining us. Today on the show, we're putting practice efficiency under the microscope with the help of two highly knowledgeable guests, Dr. Link Welborn, Chief Veterinary Officer for Covetrus in North America and the owner of 6 AAHA-accredited hospitals in Tampa, Florida, and Stephanie Foster, Director of Customer Education at Covetrus. Stephanie and Link, welcome to the show.
Thanks. Great to be here.
Same.
So we like to start with the hard-hitting questions here on the podcast. So are you dog lovers, cat lovers, all of the above, something else? Do tell.
I actually fall into not only both categories with 2 Springer Spaniels and 2 cats, but also 2 birds. I've got a yellow-naped Amazon and a blue and gold macaw as well.
Nice.
I didn't know that about you, Dr. Welborn. I am team dog all the way. I spent a lot of years wrangling cats in clinic, and I love me some dog. I like having a pet that looks up to me and wants to spend time with me instead of bossing me around. So I have a 6-year-old Ruby Cavalier King Charles.
Aww. That's awesome. So switching gears, tell listeners a little bit about your individual backgrounds and what makes you passionate about animal health?
Well, I came from practice background. So I spent 20 years in veterinary practices, hospital administrator ultimately towards the end of my tenure, and really enjoyed problem solving and working with customers and getting to work with diagnosticians, and really enjoyed that aspect of things. After that, I became a practice consultant, and now working for Covetrus, I get the best of both worlds because I get to work with our customers and help them succeed, and still be able to be tuned in to veterinary medicine, but providing solutions for our veterinary practices.
So, and I think Stephanie does have an amazing job, and I've got one as well. So I've been a veterinarian for 40 years and still see patients a couple of days a week, and putting that together with my other activities like that with Covetrus has been an amazing opportunity. Just providing care for pets that provide unconditional love for people is an incredible privilege. And when you think about it, it's the people that own pets are pretty nice, and veterinarians are pretty nice people. The people that work with veterinarians are pretty nice people. We really are privileged to have the opportunity to work in the field we do.
I couldn't agree more. It's a wonderful community to be in, and thank you for that. So let's dive into some questions. The American Veterinary Medical Association recently studied 60 veterinary practices. I'm going to throw some numbers at you. They studied 60 veterinary practices, then they rated their efficiency. They found that highly efficient practices accommodated 75% more appointments per veterinarian than practices that were deemed less efficient. Wow. Importantly, this higher efficiency translated into more animal care. Highly efficient practices reported 10% more visits than less efficient clinics. Now, clearly, efficiency represents an area of opportunity. Can you start by walking us through what is not working today in the clinic?
Well, some of it is just sort of the nature of the beast, you might say. General veterinary practice, which is also, primary care practice, has always been innately inefficient in comparison to human healthcare, whether we're talking about dentistry or care that's provided by physicians. And that's because in primary care veterinary practice, you're providing care for multiple species, at least dogs and cats, and the entire breadth of their medical needs. So a veterinarian may see a dog that needs care for its skin disease, and the next appointment may be a puppy for wellness care, and the next a vomiting cat. There's just so much variety that's driven by the needs of the client and the patient, not by the practice. And by comparison, in human healthcare, they have one species and often a finite age range and a set of medical needs. And so the reality is that veterinary practices have been able to overcome inefficiencies because of abundant, relatively inexpensive labor. And those days are over. So practices really need to address inefficiency now in a way that, frankly, they didn't need to in the past. So inefficiency can be improved greatly by assuring that all staff members, from veterinarians to animal attendants, are fully trained in their jobs and are utilized optimally. All too often we still have veterinarians that are doing venipuncture and placing IV catheters or taking X-rays. Those are duties that should be performed by others, and unfortunately, there's highly skilled veterinary technicians that are sometimes relegated to serving as animal holders. But the reality is that job satisfaction and fulfillment and retention are all enhanced when employees are performing the highest level of work for which they're trained. Just think about it. I mean, there are very few of us that are satisfied when we're performing duties that you're considered to be menial labor.
That's so true. So it sounds like a practice might want to first get a handle on what's not working with their specific workflow before making changes.
Yeah, that's definitely true. And some of it's pretty obvious if you start looking around a practice. Just think about trying to eliminate duplicate effort, for instance. Think about a lot of practices. They'll have a team member, like a technician, go into the exam room and ask questions about the medical needs of that pet. And then they'll come out of the exam room and the veterinarian will go in and they'll do the same thing all over again, sometimes asking some of the same questions, which is not only a waste of time, but also can be annoying to clients. So one way to get around something like that, for instance, would be to leverage technology by sending a questionnaire to the client in advance of the visit, for instance, through email, having that questionnaire returned and reviewing it before the actual visit starts. And then to the extent that it's necessary, kind of augmenting that with a shorter conversation, one conversation with the client. I mean, there's simple things like that any practice could take advantage of. The other thing is just thinking about trying to make sure that everything in the practice has its home. Every item, that is, if it's the microscope slides or it's an otoscope, making sure that everybody knows where it belongs and everybody commits to putting it back where it belongs if they're the one that's taking it away. Veterinarians are typically the biggest culprits there, so you have to get them to commit too. And the best way to do that is that, for every room, everybody that utilizes that room, you get them all together. Everybody agrees this is where the microscope slides go. And then, once again, commit to making sure they're stocked on a regular basis, and that to the extent that somebody moves them out of their place, they put them back. Those are easy, inexpensive things to do that can really make a difference.
So it sounds like you're talking about something like a time and motion type of study of their flows inside the clinic.
Yeah, I think time and motion studies have really great, they can be very complex. And when I first learned about time and motion studies, I learned about them in a very complex methodology, right? So you're unpacking all of the steps that go into something and determining how long it takes, but they can be very well simplified. And it really comes down to looking at all of the steps that it takes to execute a certain system. And so my practice, for instance, we were struggling with special order diets. I knew that it was taking us a ton of time. It's a low margin item for our clinic. And we were trying to figure out how do we really understand, are we losing money? Are we making money? We don't know. And so we did a simple time and motion study. And so we walked through, these are the 7 steps that it takes to fulfill an order. And I had my team spend, take 3 or 4 phone calls and give me an average of how long does it take to take the phone call from the customer and then put in the order, and then for my inventory manager to take that through the execution of ordering and receiving, and then calling the owner and the transaction at the end. And what we found was it took 40 minutes on average for every special order that we did. And based on the wages at that time, we should have stapled a $5 bill to every bag of food before we sent it out the door. We were paying people to buy food from us. And so you can do simple time motion studies. It can be on a process. It could actually be physical steps. Do we need to move this thing because we spend an extra 1,000 steps a month to get from, point A to point B over and over and over again? So it could be just configuring where things are located in your practice to save time. And if you can save 5, 10, 15 minutes a day, you start being, more efficient. Your team members can be focused on the things that are most important to you, or you can see more exams, or your doctors get out on time. So there's lots of different ways that you can use that time that you win back, but you have to measure it first before you can determine where you have that extra time that you can utilize elsewhere.
Right. And it just makes me think of that AVMA study that I mentioned, how those highly efficient practices, they could use those gains to then have more visits, which is exactly what we would love to do.
Yeah, absolutely. I mean, I never talk to clinics that are lacking for customers. They have people that are pounding on their door, and they've got, those emergent calls that call in the morning of, and they need to get in, and we don't have any openings. And so it's critical that we save time, because we can treat more patients. And ultimately, I think that's what everyone wants, regardless of revenue or efficiencies. It really comes down to being able to take care of more animals.
1,000%. We know technology can improve efficiency. Our research on our own Pulse solution shows it saves time, for example. If a busy practice owner is weighing new technology, what are some smart places for them to start?
I think it really comes around automation, and how do you balance automation with retaining that relationship with your customer. And I think looking at how your medical charts are configured within your practice management software, how you're taking payments. For instance, if you have an integrated payment solution, you are able to eliminate the clerical errors of human putting in numbers and sometimes transposing them. I can't tell you the number of calls I got at the end of the day when I was in practice. We can't balance the books, Stephanie. What do we do? And, usually a fresh set of eyes in the morning would find the issue because they've been staring at it for an hour. And so those are the kinds of things that kill time and drive up your labor. You have prescription management. If you've got prescriptions that are coming in from third parties, number one, with online pharmacy, you can retain that revenue and relationship with your customer, but you can also automate some things. And if you've got right back into your practice management software, you don't have to worry about double entry. And then wellness plans, those have grown from a kind of subscription-based system where, clients buy a package and they sometimes use it and they sometimes don't, into really a better program for people to be able to budget their veterinary expenses over the course of the year. And with our VCP, Covetrus wellness plans or care plans, we're able to really offer a way for customers to add on that dental extraction and pay for it over the course of time. And it really does, going back to Dr. Welborn's comments about the exam room, it eliminates some of the conversations that you have to have over and over, because the customer knows all of these things are coming. And so when you have to do a combination of those two things, right? You have to build efficient workflows and utilize technology in a way that allows you to be, as efficient as possible. There's the steps and the manual labor that goes into it, but also when can you go to automation rather than having someone pick up the phone? I think about all the callbacks that my team did over the years. And I know Dr. Welborn's team does this too. We're calling in, we're checking on those patients, and it's important. We want to know how they're doing, but we get voicemail over and over and over, and we're leaving voicemails. And then sometimes customers call you back, sometimes they don't. What if you could send a text that still has the same feel good, feeling that they get, and they're more likely to receive it and they're more likely to respond. And so there are ways that we can actually lean into how our customers communicate outside of the veterinary walls and establish those in our own practices.
Yeah, I'm just thinking of my own vet because my poor Roxy had to have a couple of extractions, and I would have loved if she had some sort of care plan or dental plan for that because that was a little bit of a shock, can't lie. And then I do want to give them a ton of props though, because they are very good about sending me text messages, reminding me, no food or treats after 10 p.m. the night before. So I love that part of the technology aspect of it. And just to kind of like continue on this thread. So we talked about higher efficiency as a big payoff from technology, but what are some other benefits that maybe you've seen, Stephanie, working in practice?
I think customer loyalty really is the critical piece. I mean, no matter which kind of practice you're running, ultimately you want your customers to be loyal to you. You want them to come back. You want them to look to you as the expert. And we can't be all things to all people all the time and be able to sustain that pace. We ask our teams to do a lot of things in the practice. And it's a lot of communication, it's a lot of talking, it's a lot of follow-up. We're asking our doctors to complete their medical records, and sometimes that can be a challenge. And so they end up staying late. And so we have a state of burnout and fatigue in our clinics because we are trying to do so many things. And so when we utilize technology to have extra touches with our customers, I think that for a while there was this perception that was going to break down the relationship with your customer, that face-to-face was all there was. And if you couldn't get that it was going to break things down. And what we found actually is that a lot of times our customers don't want to talk to us, right? They'd much rather get a message to remind them of something. It keeps us front of mind. And when they do need to talk to us, knowing that we're there. And I think sometimes we miss that extra step. We've had the face-to-face in the exam room. We've made that connection. We've built trust and rapport. And then we don't talk to them again until they're due for something else. And so if we can use technology to continue to keep that relationship open, it actually does build loyalty rather than degrade it. So I think it's something that we've had to kind of have a philosophical shift, a mental shift in our industry to really understand that tech touch is not a bad thing, right? It is something actually that puts us in our customers' inbox, in their phone, in their text messages, and does actually build relationship rather than break it down.
Right. And it meets customers, like myself, where I am. It's much easier for me to receive a text message. And then I know my vet's thinking about me.
Absolutely. And think about home delivery and those kinds of things. I can count on two hands the number of times I've been to the grocery store in the last 5 years. I use Shipt. I prefer that. I don't like being hangry in the aisles of the grocery store in front of other people. I'd much rather just order it. So, we have to meet our customers where they are. And oftentimes they don't want to have to make a stop. They don't want to have to pull into your parking lot. They don't want to have to turn left at the tough intersection, right? There's lots of different reasons that they don't want to stop in your clinic. When I was a kid, we spent all day every Saturday going around to all of the different, places that we needed to stop in the brick and mortar stores, and that's a thing of the past, right? So we've got to be in the future and understand what our customers are looking for.
Yeah, absolutely. This has been a fascinating conversation. Thank you so much to both of you for coming on the Covetrus Connected Care podcast.
Thanks very much.
Our pleasure. Thank you.